Hey there, welcome back to the Complicated Kids podcast. I'm your host, Gabrielle Nicolay. I am a toddler whisperer, a speech therapist, and a parent coach. And today I have Karin Varblow with me. Karin, welcome.
Thank you very much. It's a pleasure to be here.
I'm so happy to have you because, number one, and I'm going to ask you to introduce yourself and your expertise in a second, but there are very few people doing what you do with your amount of training. So that's the first reason I'm excited. And I'm also excited for our topic, which is we're going to be diving into untreated ADHD in just a second. And so before we do that, tell the good people a little bit about yourself and what you do.
Okay. I, in typical ADHD fashion, my history is a windy road. So I was a teacher for a couple of years when I graduated from college, then started in a master's in social work program and got most of the way through that before I decided that I wanted to be a doctor. So started back to college again with the undergrad pre-meds, went to medical school, and um, I was a National Health Service Corps scholar, so I spent a couple of years in a medically underserved area, which was fascinating. I learned a ton, and then started in private practice in general pediatrics. Um, Along the way, I myself was diagnosed with ADHD when I was in medical school, so that sort of started my interest in it and learning about it. But even more relevant is that early in my years as a private practice pediatrician, I had my own children, and they both have ADHD and other neurodivergence issues. And when they were small, I was trying to get support for them and their ADHD. And I was so frustrated because every specialist that I went to contradicted every other specialist that I went to. You know, the OTs contradicted the play therapists, who contradicted the cognitive therapists, who contradicted the psychiatrists, and on and on and on. And as a primary care provider and an ex-social worker, providing coherent, cohesive, coordinated care is central to who I am. And so I decided that maybe I was as good a person to develop that plan as anybody else and started learning everything I could learn about ADHD. Um, Became a pretty good coordinated care provider for my own family and decided that that might be a service that I could offer to other people. So for about the last 15 years or so, I've been working exclusively with kids and families with ADHD and other neurodivergence. My focus has broadened as I've learned more and more over the years. But ADHD is still really my first love,
Yeah.
my first professional love.
It's so interesting. A couple of things. One is lots of kids just they start out thinking they want to go to med school and then go to social work school. You did the opposite.
I did, yeah. I did, yeah.
And I
The
think,
hard way.
yeah,
Always,
I think that's
always the hard way.
always, but that speaks to your brain, right? That speaks to the kind of mind you have, and that's delightful. Probably
Thank you.
mostly
Thanks.
in the rearview mirror, perhaps, but and part of the reason I want to highlight that is because the families who listen to this podcast, the parents and the educators for that matter, um, providers, all of the people are people who are interfacing with brains and nervous systems who function a little bit like that. And so just a little bit of like rear view mirror perspective on it's okay. It's going to be real okay.
Not only is it okay, but it ended up coming so full circle so that every minute of the path ended up feeding the outcome sort of so far, right?
Right. Right. Which you can,
I couldn't have planned it any better
yeah. And you can
if
really
I had planned
only,
it, which I did not.
which we didn't. And you can only see that looking backwards. And
Right.
while you're walking it, it feels very confusing, probably.
Yes, it does.
Uh-huh. Okay, so you are an example, your kids are not an example of untreated ADHD. Yeah?
But I was, yes,
And
indeed.
so tell me, why is it important to diagnose and treat ADHD?
When I first started doing this work, I, like many people, was really thinking about ADHD in terms of academic performance.
Mhm.
And I was thinking that, my kids were small. It was pretty clear to me that they had ADHD. They came by it honestly. They were quite hyperactive, and quite curious. Um, but they were in preschool, so how could it possibly matter? And I continued in that line of thinking until my son at age 5 came home from summer camp one day crying. And he said, the counselors keep telling me that they have to say my name over and over and over again before I hear them. And I don't understand what's wrong with me. What is wrong with me that they have to keep working so hard to get my attention and keep my attention? And I was like, okay, here we go. I guess we're going down this road at 5, and it has nothing to do with academics. It has to do with self-esteem and identity and questions about, who am I and how do I interface with the world? Um, I do like to give my kids credit for teaching me pretty much everything I know professionally. So shout out to them, just by the way. Um, the more I have learned about ADHD and the impacts that living with it has, um, the more I understand it not only as something that can make the difference between maybe C's and A's or B's and A's or whatever, but it's something that is impactful in every moment of a person's life, every moment of a person's life. And it turns out that there is more and more and more data. People have been collecting data on this since about 1980 on what happens to those of us who have ADHD who are treated and what happens when we are untreated or inadequately treated. And I am here to tell you that every poor outcome that you can possibly imagine, there is evidence to show that untreated ADHD leads to worse outcomes than treated ADHD.
And
Hands
so,
down every time.
give us just a sample of what those life areas are, please.
Sure. So it includes, little things, maybe quote little things like, self-esteem or, um, sleep disorders.
Mhm.
But it includes other things, maybe dental issues, right? Not only cavities, but also trauma, dental trauma. But it includes bigger things too. Poverty, educational achievement, how much people get paid in their work as adults, how likely they are to go to prison, how many times per year or whatever they visit the emergency room,
Mhm.
how long they live. There are current estimates are that people with ADHD, untreated ADHD, have a life expectancy that is anywhere from 8 to 13 years shorter than non-ADHDers on average.
Okay, so that's astounding, number one. And that is a broad range of factors. And let's talk about what we mean by untreated ADHD, because it sounds like what you're saying is those statistics are very, very different for people with ADHD who are treated. So what's the difference here between treatment and not treatment? Like what are we talking about?
Yeah, and I should actually even back up another step, which is to say that if you look at people who have ADHD and compare them to people who don't have ADHD, every outcome is likely to be worse for the people with ADHD than for the people without. And treatment tends not to get them quite back up to even par with the people who don't have ADHD. So already, in the best of circumstances, if you were born with ADHD wiring, you have a higher risk for all of these negative outcomes. But then, if again, we can separate the group of ADDers into those who are treated adequately and those who are not. And then we see another split in the outcomes. So let's talk about, well, what does treatment mean, first of all, right? Because it's hard to sort of really dial down on how you separate these two groups if we don't understand what treatment is. And it's different from, I think, what a lot of people commonly assume to be the case. There was a huge study, several years ago now, that was conducted across several different institutions across the country. And they found that ultimately there are three things that work well to treat ADHD in large numbers of kids. One is medication management. One other is behavior modification. And the third is the combination of those two. So medication and behavior modification. That combination works best of all. The next best option is medication alone. And the third best option is behavior modification alone. So, okay, that sounds reasonable. Let's talk about behavior modification, because this is where I think there is often a lot of confusion. Mm-hmm. Behavior modification sounds like the kind of thing that you would drop your kid off to the therapist or the doctor or the counselor or somebody and say, do behavior modification on my kid to fix their ADHD, would you please? And I'll pick them back up in an hour. And I have bad news for some of the parents who are really hoping that that's the way it works, because it's not the way it works. Mm-mm. What behavior modification is actually training for the parents so that they can elicit different behaviors from their kids and learn how to bring out the best in their children. So that's sort of a very, very key component to adequate treatment for ADHD. Okay, so now I've lost track of what your original question was.
You're good. You're good. Behavior modification on its own, medication on its own, both are effective. They're most effective together. I want to do a side quest here for just a second, because you mentioned dental issues and sleep issues, and you may or may not be prepared to discuss this. We did not plan this prior to hitting record, so you just tell me. To me, that says airway, and so sleep apnea being an airway disorder, and when the brain is not properly oxygenated, and when we don't have nasal breathing, which happens, which we need for optimal health and well-being. I don't know if you want to talk a little bit about how sleep and breathing impact brain function, i.e., in ADHD.
Yeah. So, and this is to me just a really fascinating element of this field that is like exploding right now as we speak, because it can be bi-directional. So in other words, right, if you're not sleeping well for whatever reason, that's going to impact your brain function, and it will absolutely exacerbate any ADHD tendencies that you might have. And if you have an ADHD brain, it tends to be difficult often to get adequate sleep for a large number of reasons. But one of the most sort of compelling is it's really hard to wind down to go to sleep when your brain and your body are just so busy and so driven to just move and keep flipping through all of the things, in front of it. And so it can be hard to fall asleep. It can be hard to stay asleep. And so it kind of goes both ways. Mm-hmm. But since you're talking about airway, there's all this really fascinating research into the connection between ADHD and allergies and mast cell activation syndrome and inflammation and GI issues. And again, since you're talking about airway, even connective tissue disorders. So if you have a connective tissue disorder in which your collagen's a little bit floppy, your airway might be a little bit floppy, which might lead to sleep apnea, which might exacerbate your ADHD if you have ADHD. It might actually make you look like you have ADHD, even if you don't have ADHD. And around this cycle goes. And I did some some continuing education recently and learned more about actually an astounding connection between, we're going to have to edit this,
That's okay.
narcolepsy,
Yeah.
between narcolepsy and ADHD and other neurodivergence. And narcolepsy is not as defined, by what I learned recently, is not the narcolepsy that I used to think of as narcolepsy. It doesn't mean that you are walking down the street and you fall asleep in the middle of the intersection or whatever, right?
Right. Yeah.
There are all kinds of disordered sleep conditions that also tend to go hand in hand with ADHD. So then we get into a real chicken and egg kind of a question, and it gets fascinating to me.
It's so, I love, these are the conversations I love, and this is why we have the podcast, because this bidirectionality of the body and the brain is, I think this is a new-ish concept, right? That
Yeah.
everything is always interacting. We're not just, this is not a one-way street. We don't eat a food and then it only acts one way on our body. That food is broken down into many different substances that are picked up by many different organs and systems and used for different things. And I'm just using a food example because that's what popped into my head. But to your point about like, there's immune involvement in neurodivergence. There's allergies, which is like a subset of immune, right, function in neurodivergent, and that these things are traveling together and acting upon each other is, I think it's really exciting. It makes it very complicated.
Yes, it does.
Right? Because like we want there to be a narrative in which we're like, you have ADHD, you take this medication and you go to this behavioral program. Let's just say we like follow the evidence. And now you're a fully functional human that nobody has to worry about. It's not how it works.
No.
So I think now let's like come back onto the main path. Thank you for the side quest. And talk about like, let's assume treatment. Let's assume individualized good care and treatment. And sorry, pause for another side quest. Differential diagnosis, because you mentioned like sleep disorders can make you look like you have ADHD, even if you don't. How do you engage in that process to decide if somebody does have an ADHD brain?
Right. So the differential diagnosis list is really long. It's almost infinite. We could talk about anxiety and depression and tic disorders and other movement disorders. We can talk about learning disabilities, dyslexia. We can talk about eating disorders, obesity, and all of the subsequent diseases and conditions that can go along with obesity. We can talk about just sort of while we're on co-occurring conditions, teen and other unplanned pregnancies. Gambling addictions, substance use and use disorders, violence, both as a perpetrator and as a victim. Females with ADHD are more likely to be victims of domestic violence and sexual violence than females without ADHD. And I'm sure, haven't read this, but I'm sure that also applies to other non-binary, sort of marginalized groups. Mm-hmm. So really anything you can think of, right? And so how do you determine which came first and right? Because then now we're talking about trauma, and trauma can look a lot like ADHD, right? So like, where does it start and where does it end? And ultimately, I mean, there are lots of ways to get at whether or not somebody sort of, quote, meets criteria for an ADHD diagnosis, right? And that's one way to look at it. I've actually developed a model that I use, which is a little bit more conceptual than sort of checking the boxes. And we can go into that if you want.
Yeah.
That sort of looks at like, okay, well, how do you make decisions? Because people with ADHD make decisions differently from people without ADHD. And to me, how much self-control do you have over your behavior, over where your brain goes, over where your body goes, over where your body parts go. When, under what conditions do you have more or less self-control? And that, to me, is a way to understand whether or not we're really talking about ADHD, or we're talking about something else that may be masking or co-occurring or whatever. Yeah.
You're describing a very functional view of diagnosing, which I love. Like, how does this impact you? Not do like meet criteria, like anybody on
Right.
any given day. I'm exaggerating a little bit for effect, but like you could diagnose me with, several different things at any given moment. If we were using a checklist, but like on an
Right.
ongoing basis, am I able to make decisions, with this kind of process? I actually think that that's awesome. I am very much about like, how do we function in the real world and what does it mean and how do we get better at doing the things that we need to be doing? Which is another kind of area of, I have apologies for like, I'm going to rapid fire a couple of questions at you. Is ADHD increasing? And let's stop here. Is it increasing? And if so, why? And if not, why not?
Right. I don't know is
Okay.
the honest answer to whether or not it's increasing. What I know is that it is both overdiagnosed and underdiagnosed, which is another conundrum because that's everything about ADHD is sort of a conundrum and is its own, set of contradictions. Um, when I think about ADHD, I can just go, I'll give you the sort of short version of my model. I call it the no-go model, KNOW/go model. And I think of the brain as sort of two conceptual parts. One is the no part of the brain, again, KNOW part of the brain, the other is the go part of the brain. The no part of the brain is where we keep track of all the stuff that we know, the spelling words that we've memorized, the math facts that we've gotten automaticity on, the rules for in the classroom versus grandma's house versus on the soccer field, the likely consequences for X behavior or Y behavior. But even more, it's like our value system, our moral code, what's okay and what's just not okay, what's just off the table, what's important and what isn't that important to any one individual. Because we don't always have put the same weight on different values. What are our goals? What do we expect to do later today? And what do we hope to do later in life? All of the things live in the no part of the brain. And theoretically, well, I'll come back to that. So that's the no part of the brain. The go part of the brain doesn't do any thinking. The go part of the brain is essentially the bus driver who turns the steering wheel left or right, hits the gas or hits the brakes, right? And there's no thinking. So when we think about how decision making works, ideally, if we are come to a metaphorical fork in the road and we can either do this or we can do that, what is ideally what happens is we pause and we sift through all the things that we know, anything that's relevant that gives us some guesstimate as to which fork is going to be the better fork to take. And we sift through what we know and we say, you know what? I think the right hand fork is going to be the way to go. And so we send that message from the no part of our brain to the go part of our brain. The go part of the brain hits the brakes on the left-hand fork, turns the steering wheel to the right, hits the accelerator to the right-hand fork, and off we go. Maybe it ends well, maybe it doesn't. But either way, we make a note to self. And we post that note in our no box, in our knowledge bank, that says, tomorrow, let's do it differently because this did not work well at all. Or, wow, let's do this again. This was awesome, right? Either way, there's a bright pink sticky now in our brains. And so the next day, when we come to a similar fork in the road, we sift through what we know. Oh, there's that bright pink sticky. Now the decision is that much easier. And that all assumes, of course, that we don't have ADHD and or that even if we do have ADHD, the decision tree has to do with a preferred activity. So now if you have ADHD and you come to a fork in the road, and at least one of the forks involves a non-preferred activity, there is no sifting through anything that we know. That part doesn't happen because instantly the go part of the brain just like does a reflexive turn to the right, hits the brakes to the left, turns to the right with no thought. It's just a reflex, the same way that if you go to the doctor and they bang your knee in that special place, your leg kicks, right? It's no different.
This is very
When I'm
interesting. Keep
evaluating
talking.
for
Go ahead.
when I'm evaluating for ADHD, I want to know, like, is this what happens in your world? Because here's the next step, right? So you if maybe at some point mom or dad comes in the room and says, ah, why did you make that choice? Why did you do the thing that you're doing? The honest answer, I don't know. I don't know. But either way, mom talks to us, lectures us, makes sure to fill in all the blanks that she could possibly imagine must be the reason that we made that poor, quote, choice. We make bright pink stickies, we put them there in the knowledge bank, and tomorrow comes and we do the same thing again and again and again and again. Because it's not that we don't have that knowledge in the knowledge bank. It's that we never had the time to sift through it and consult it. The go just went. And we find ourselves down some fork in the road and look up at some point and say, whoa, how did I get here?
And that is a moment of heartbreak for everybody. I tell parents this all the time. Your child is as upset as you are, probably more
That's
so.
so true. More so.
At their own actions. They actually have no idea how this situation happened. And imagine you're at the center of an action that you don't understand how you got there. That's very confusing.
Not only that, but I'll tell you what's even worse, Gabrielle, is what it means is that if you have ADHD, you cannot rely on yourself to behave in accordance with your own moral code and your own value system.
Oh, wow.
Like, wow, right?
Yeah.
That's big. That's not going to end well.
No, and then you get to listen to an adult re-explain what you already know. And I say this to parents all the time. They know.
Yep.
They know they're not supposed to hit their sister. Of course they know.
Right?
They just can't not hit their sister right now.
But by listening to you give them that information again, as if they were too stupid to have remembered it the last 97 times you told them, the real message that they are getting and holding on to is mom thinks you're stupid.
Right. And therefore, I'm stupid because my mom can't be wrong, because kids don't think that their parents can be wrong, right? So then there's this whole process that happens, and
they've learned that they can't trust their own judgment, as we've already talked about. So how could they second guess mom?
Yeah. Okay, let's take this situation. Okay. So let's can we work with like shoving, pushing, or something?
Yeah. Yep. That's one of my favorite examples. Yep.
Great. Okay. So what do we do about that? About pushing?
That's the $1 million question.
Yeah.
Because clearly the things that have been tried since humans walked this earth include things like consequences, punishment, maybe at best, teaching. Maybe Joey didn't understand the last, again, 97 times that I explained why he's not supposed to, or she's not supposed to hit their sister, right? Maybe at some level, we assume that there's a deficit in the knowledge bank. Either the kid doesn't know the rule, or the kid knows the rule but doesn't really get how important it is. And so all of the disciplinary measures that adults take are designed to either make sure that that kid remembers that rule, or make sure that that kid really understands how vitally important it is. And so theoretically, the bigger the consequence, sort of the more that's supposed to impart the danger associated with not following the rule, right? Or the reasoning behind the rule's existence. And the truth is that it doesn't work, because no matter how many stickies there are and how many colors they are and how big they are, if you can't see them, they don't help. So here's the thing, and this is what really got me interested in sort of questioning the whole concept of this myth, in my opinion, that people with ADHD have poor executive function.
Hmm.
Hmm. I don't know about you, Gabrielle. Have you ever like watched a kid with ADHD do something they love to do? Like, I don't know, if you have somebody who loves to like build with Legos,
Yeah.
right?
Yeah.
We think about executive function. So select a goal, think about, okay, what are the steps I need to take to get to that goal? How do I sequence all of those steps? How do I follow all of those steps without getting distracted and without losing my way? If I bump into an obstacle, how do I get around that obstacle so I can still meet the goal? How do I finish every last little bitty, stupid, detailed little step of to meet the goal so that I can finally tie the bow and call it done and take a bow? All of those things are executive function. That's what executive function is. We need to maintain the emotional regulation to keep it like all of that. Well, if you've ever watched a kid who loves to build with Legos, their executive function is not just adequate, it's phenomenal, right? So, but every book you will read on ADHD will tell you that people with ADHD have poor executive function and they need executive function skills training. And I just don't see it. I just don't see it. So, so what I started thinking about is what's the difference for the kid who is being told to do their math homework versus the kid who gets to play with Legos? Because they do lack sort of operationalized executive function when they're told to do their math homework, and they don't lack operationalized executive function when they're playing with Legos. What is that? And what I ultimately came up with is the answer is stimulation. When the brain is stimulated, the no and the go connect with each other. And we can access the no before we go. And we can direct the go with what we know. Okay. So when this kiddo is excited to build the new Lego project, the no and the go are absolutely connected, and they are thinking through all of the executive function sort of required steps to getting to their goal. When somebody tells them to do their math homework at the time that they want them to do the math homework, because they want them to do the math homework, the way they want them to do the math homework, and show their work the way they want them to show the work, all of these things, because I said so, all of a sudden, like even staying awake is an executive function that is beyond possible sometimes. Or if you happen to be in medical school and don't know that you have ADHD and you're trying to study for exams, staying awake can be a real thing. Just saying, for a friend.
Asking hypothetically, very hypothetically. There's so much goodness in what you're saying. It occurs to me as you're talking, also, one of the hallmarks of ADHD is a reduced, well, I'm going to describe it this way, and you tell me what you think of this. It's kind of a reduced bandwidth, a reduced window of tolerance for other people's stuff, right? Other people's important things, and not what I find interesting or important. After which, and so, and I do see this even with like with the Lego set, a kid could bump up against their window of tolerance pretty quickly because it's pretty small. And so the amount of time that a kid with ADHD spends in a dysregulated state versus in a regulated state, which is what we're talking about when we're talking about that bandwidth, is more than the average bear. Yeah.
So if you think about what gets a kid from, again, I think of it in terms of the no and the go. Are they connected or are they disconnected? Much for a kid who is in school, if their non-preferred activity is sitting still inside with harsh lighting, listening to somebody else talk at them about something that they think is important, but the kid doesn't really care about even a little bit. And if that's sort of your non-preferred milieu, I got bad news for you, kid. You have a lot of years and a lot of hours in this sort of non-preferred milieu.
Yeah.
So the percentage of time that you spend in that state is much greater than the percentage of time that you spend in a state where you are doing your thing and rocking it.
Mm-hmm.
Okay, this is why we typically don't like to diagnose ADHD before school age, because for the most part, preschoolers kind of get to do their own thing.
Yep.
And so they rock at it,
Yep.
right? It's not until they're really sort of directed to fall in line that the problems really start to show. So when we look at the percentage of time that the kid is sort of out of sorts and out of their groove, and the no and the go are disconnected, it's far greater than the percentage of time where they are doing their best and they are thriving. That percentage is what separates the ADDers from the rest of humanity.
Yeah.
We all have times when we're not at our best,
Yeah.
right? But if we're not at our best and we don't have ADHD, I like to describe it as there's a dimmer switch.
Yeah.
So if you find that you're not quite, in your groove and you're not quite sort of thriving, if you don't have ADHD, there's a dimmer switch right there, and you can sort of crank it up so that you focus in a little bit more, or you try a little bit harder, or you dig a little bit deeper, or whatever it is. And you can get through that sort of non-preferred activity. If you have ADHD, there's no dimmer. In fact, it's an on-off switch, and you can't reach it from here.
Oh, wow. Yeah.
It just is on or it's off, and there's nothing that you can do about it.
Yeah.
So as much as you would like to be able to tell your brain to sort of stay in the room and stay on the page as you're studying, or stay on the page that you're reading so that you can answer the questions about it later and show that you have reading comprehension skills, if your brain decides that it wants to go to Disney World and have the best time ever, that is out of your control.
Mm.
No matter how much you would like to have control over your brain.
Okay. I really want you to say that again, because even I, who am very open, have a hard time believing you when you say that. And I'm being honest here.
Yeah. No, I appreciate
say
that.
It again.
Yeah. Okay. I'm going to give you a real life example.
Great.
Okay. Again, from my life, I'm an easy target. Again, the first time I was in undergrad, I had to take a biology class to graduate. And I was 100% certain that I would never, ever, ever use that material.
Right.
The concepts were absolutely useless to me. This has no relevance to my life, but I had to take it to graduate. And I will tell you that I spent so many hours in the library reading all of the chapters. And at the end of each 2 or 3 hour session, I would close the book and think to myself, what did I just read about? And I had no idea. I didn't know, because the whole time my eyes read every single word, my brain was somewhere far, far away, having a party or whatever it was doing. I don't know what it was doing.
Yeah.
But interestingly, once I had tried most of the other careers on the planet that were non-sciencey and decided that I needed to learn science or I was going to live on a park bench for the rest of my life, all of a sudden biology had some relevance to my life. And when I read the textbook again years later with a goal in mind and with it being relevant and exciting and interesting to me, I could read the stuff once and actually remember it. It was an entirely different experience.
Okay.
I didn't have control over where my brain went.
Yeah.
What controlled where my brain went was the greater circumstances.
Yeah. And it's interesting what you're saying. So as adults, one might have the ability to figure out what that relevant thing is, to find it. Maybe. Okay. Maybe. When we're talking about kids, and we're talking about kids in school, and the whole model of school, I mean, that's like a different podcast entirely, like a whole other series of how school fails kids. particularly kids with ADHD, because the whole thing is like, do it because I said so.
Right.
Like the whole thing from start to
Yep.
finish. Line up here because I said so, put your coat here because I said so, sit at this desk because I said so, study
Yep.
this
And
subject
don't
because I said so.
shove the kid who cut in front of you in line because I said so.
Right.
Inhibit your responses also, not just the things that you have to do, but the things you have to not do.
Right. And so is part of the treatment to find the things that will make the subject matter relevant or the task relevant or the
Yes.
okay. Yeah.
Yes. So again, remember I said that behavior modification is training for the adults so they can learn to elicit different behavior from the kids.
Mm-hmm.
If the kiddo has a real interest in sports or in movies or in pop stars or whatever, you're going to find it much easier to teach them math if they are adding, multiplying, and dividing sports statistics or how many millions of dollars the pop stars are making or whatever, making it relevant will draw the attention to the material that you're trying to teach. That is behavior modification. That's why we sort of try to get schools to engage with accommodations and differentiate some of their teaching so that they can engage the different kids with the different areas of interest. And I get that that's a very, very, very tall order, big ask, but that's another thing. Yeah, so a big part of it is figuring out how to find the relevance for the child
And the other
or
part
the
of
adult. Again,
or the adult. Right. But the other part is
so here, I will just say, like, for me, every year I always swear I'm going to do my taxes in January. Every year, and I know all of the reasons why my life will be so much better if I can just do the taxes in January. And every year, up until April 14th, when I try to do the taxes, I fall asleep. Or all of a sudden have this driving need to clean the refrigerator out or whatever. April 14th comes, and all of a sudden, my drive is to avoid, my preferred activity is staying out of jail. Oh, look at that. Now I can do the taxes.
yeah.
It takes me till midnight, but I can do it. It's the same thing.
It's so interesting. I saw something on the internet once, which is basically like procrastination is your brain's way of keeping you safe, right?
Yeah.
It's your brain's way of saying, this is not preferred. This is going to be hard. It's too much work. Let's not do it. And then you're right. When your choice is to stay out of jail, now the harder thing is the jail. So let's do the taxes. Yep. Now all of a sudden taxes becomes preferred, to your point.
Exactly. It's exactly.
This is such a great, I am delighted to be having this conversation. We're going to pin it here. And if people want to learn more about you, Dr. Varblow, what do they do, please?
The best way to find me is on my website, which is www.drkarinmd.com, and that's DRKARINMD.com. And I have all kinds of information there. There are webinars that you can view, and all my contact information is there as well.
Fantastic. And you practice in McLean, Virginia, is that correct?
I do. I do.
All right. Very nice.
And also licensed in Maryland.
Oh, fantastic. Perfect. Thank you so much for being here.
Thank you. This was super, super fun.
I'm glad.